So super excited here today to talk about one of the things that is so front and center for all of us dealing with any kind of eating disorder, and that's body image. So today to have that conversation we have with us, I don't know how it's showing up on everyone else's screen, but on my screen we have Allie Duvall, who, do you want to introduce yourself for just a moment, Allie? And
Yes, I can. My mute button decided to run all over the screen. My name's Allie, and I am our body image program manager here at Equip. I also have lived experience with recovering from an eating disorder. I went undiagnosed for about 10 years and didn't actually start my treatment until I was a sophomore in college. A lot of the reasons I didn't receive treatment was a lot of stigma due to my body size. And so I'm happy to talk any more about that, but really excited to be here.
thanks, Allie. And Dr. Cara Bohon.
Hi, I'm Cara. I am Equip's VP of Clinical Programs and clinical psychologist by training. Spent the last 15 or so years doing a lot of research actually on the brain basis of eating disorders, as well as the influence of body image and other environmental factors. So excited about talking today about some of the stuff we know and ways we are hoping to intervene and change things.
Yeah. So I'm gonna turn it over to the two of you to get us started.
So this is our agenda, and bear with me as Google Slides tends to jump forward, jump back, and go all over the place. This is a little bit of our bio like we just shared, and our agenda for today is really open, like JD said, but we do have some things that we'd love to go over. And so as questions come in, we're happy to pivot and answer and talk about those. And we also have some things that we'd love to kind of connect and share with y'all today around body image. And so just to get us started, I want to think about what is body image. It's a term we hear a lot. I know it's something that I never really understood the definition behind it. And so the way that I like to think about it is we all have it. It's something that belongs to us. It's the different ways that we interact and kind of perceive our body. And so you can think of it really as someone's experience in their body. And that goes into a bunch of different things. So it can be the perception of our body, the way that we perceive it, or the way that we view it. Can be our thoughts about our bodies. So what are we thinking? What are the cognitions? What are the thoughts when we experience our body? As well as the emotional attitudes towards our bodies. So there can be different ways that we feel towards our body. And I'm going to say body a lot. There's really no way around it. So just bear with me as I keep going. But there's a lot of different things to our body image or components to it. Another thing that comes up is all of these different body image concepts. We hear negative body image, we hear body neutrality, body liberation, radical self-love. There's a lot of conversations around those. And so I like to think of them on a spectrum when I'm thinking about how to organize them in terms of a body image journey or where someone can go. So on this left side, we have negative body image. And this is where a lot of us, unfortunately, end up because of the messages that we get from our society around how we're supposed to look a certain way. And so this can lead to body judgments, body dissatisfaction. Some example behaviors based on those things are really comparing yourself, having a distorted view of how your body is or how you exist in the world, body checking in lots of reflective surfaces or mirrors, really a hyperfixation on your body in a negative light. I put an example kind of quote at the bottom of, if my body looked like this, then my life would be perfect. I wish I looked like this. I wish I was toned like you. It can end up just leaving us feeling really crappy about ourselves. And then in the middle here, it's coming in slowly. I'm not really sure exactly what's happening here on the screen. We have a big jump there. We have a neutral body image. And so we can think of this as body neutrality, body trust, body peace. This is really calling a truce with your body, knowing that you have to exist in it in the world. And when it comes down to it, that it just is what it is. You can think about this as body function. So focusing on how your body moves or how it gets you through each day. I do like to add a caveat here that if we base it solely on function, as that function changes over time, it can lead us back into this negative body image. So we want to be careful about how we're using that for ourselves and especially with others too. It can really revolve around neutral statements. My body is the least interesting thing about me is one that typically comes up to me around body neutrality. And then on this side, we have positive body image. So radical self-love, body liberation. I don't know if anyone here is familiar with Sonia Renee Taylor's work, but she has a lot of conversations around how can you exist in this radical self-love and really use that as the way that you exist in the world. And so you can think of this as you can have radical self-love because you are already radical self-love. And that's a Sonia Renee Taylor quote. Just thinking about body joy. And what I love about thinking about this on a spectrum is it's not something where you have to be thinking about negative to positive. You can hang out in neutral body image, and that can be where you exist for your whole life. It depends on who you are and your individuality and all the different needs that you have around your body, because all of these can be supportive. We just really want to try to figure out how to get away from these negative body thoughts that we've been kind of conditioned to think about ourselves with. With that, I'll pass it over to Cara.
Yeah, and so I will take that focus on the negative part. Not that you want to focus on the negative, generally speaking, but that's where we're kind of turn. So in that spectrum, as we think about like, yeah, live in neutrality, that's totally that's great. Live in positivity, that's great too. But what's wrong with negative? Well, we know what's wrong with negative. So where are the numbers? Why do we care about this? Why do we want to do something about this? We know that 30 million American women struggle with negative body image. And we say struggle because that's how it gets described and that's how it feels. 21 million American women are at some point in recovery from an eating disorder, and 4.3 million American women have an active eating disorder. We know that negative body image, body dissatisfaction, is a potent predictor of the development of an eating disorder. And so these things matter. They have big effects both on developing into a full-blown eating disorder, as well as even when it's not an eating disorder, but still has a lot of negative impact on our self-esteem, on our relationships, and things like that. And it's not just women. This was a recent article from last fall in the Wall Street Journal, but highlighting that boys have eating disorders too. And we know that it is a body image driven illness for a lot of people. And I know I don't know if anyone on the call knows about or has thought about ARFID, or avoidant restrictive food intake disorder, where the distinction there in the diagnosis really is in a lack of body image. But that's also not totally true either, because it's not that there's not body image concerns or not negative body image present that was still interfering with people's well-being. It just may not be the driver of their eating disorder. So it's still something that is touching a whole lot of people in a negative way and impacting their lives. And the last thing I'll say in terms of this piece is also denoting this binary. I just talked about women, then I talked about boys and men. And we often talk about appearance ideals in a binary. So when we think about body image and how we're supposed to look, we often are seeing things split into appearance ideals that are masculine or feminine, and aren't really allowing for much in the middle. So with that, I will bounce back to you, Allie.
And so what I'd love for everyone to do in the chat right now is think about what the perfect woman looks like according to society. And I'd love for you to throw in characteristics or things that come to your mind. And I will attempt to annotate on the screen. So bear with me on this. I will spell things wrong. But as we see things pop in, love for maybe Cara, if you can call them out.
There we go. People are getting with it.
Yeah. So we've got starved, beaten and starved. We've got long hair, well cut, thin, Barbie, tall, muscular, fit and strong, curvy, a long body, busty, flawless. I'm skipping the repeats just as I say them out loud, but just to note that there's a lot of tall, a lot of thin, large breasts, big booty, tiny waist, that hourglass. The next one says hourglass, which is the same kind of thing. Someone says a waif body, but a large chest. And that's from the same person. So
Mhm.
the combo there. Firm boobs. I like that, that specificity there. Long legs, couple of long legs. Sexy looking, so that sexualization part. This person says anything that looks like it belongs in the porn industry.
Mhm.
Back to that sex appeal factor. This
We
person
have
says
such a long list. And
yeah,
what's so interesting to me as these are coming in is there's so many contradictions of you have to have small waist, but huge boobs and a huge butt. You also have to be muscular, fit, strong, but also thin and sexual and have long hair. It has to be well cut. There's so many very restrictive and narrow ideals here.
the last one that just came in says airbrushed, which I think also kind of fits that same thing of the like impossibility of it.
Absolutely, because pores, we don't need them, right? That's definitely not something that helps our body in any way. And it's so interesting with the airbrush piece too, because it's like natural, but not too natural. Like you have to be this like weird mix of done up, but not too much effort that it looks like you're trying. Which how do you even make that happen? And so what I love to also do is I love to do this again, but thinking about, I think I have to stop annotating, so bear with me. Thinking about this, but for the perfect man as well. So I'd love to have people again throw things in the chat. I'd love to see what comes up. What does society say the perfect man looks like?
Tan,
Mhm.
6-pack, tall, thin, strong, and muscular. No belly. Lots of musculars, and lots of abs. Comments.
So all the abs, all the muscles.
Yeah, fit. Strong jaw.
Mhm.
Jawline.
Another thing that I hear here too, or what I've heard before, is the Dorito body, where it's like very broad shoulders, but super narrow waist.
This person says chiseled.
Mhm. Anything else that's coming in for the perfect man?
We've slowed down on the perfect man features.
Interesting. I think that's something that I have seen though, is it people can typically think of that perfect woman a little bit faster, where the perfect man is harder to think about sometimes. And there
we
are still
got a few more. The great head of hair. So the no balding. Yeah, not bald, no balding.
Mm-hmm.
That athletic look, athletic appearance.
Mm-hmm. I think these also show just an extremely narrow ideal for men to fit into. And again, like you said, Cara, like there's still the binary. We're still only talking about the perfect woman and the perfect man. And the assumption too is that you fit into one of these categories, or you should be trying to achieve to one of these very narrow categories. Thank you all so much for participating in that. I know it can be kind of hard to throw things in the chat that fast. I'm gonna stop.
And our goal in that conversation, really, as Ali was highlighting, is really to think about not like how narrow the ideals are, but also how unattainable they are, how contradictory they are, or how impossible they are for like the average person to actually achieve.
Well, and they also shift over time too. They're constantly, I remember when I was in high school, it was all about the thigh gap, but now that's no longer the conversation, or is it? It's kind of completely transformed. And then they also cycle back. And so it's not only is it unachievable, super narrow, it's constantly changing. It's completely impossible to attain regardless of how much effort you put into it.
Even if you got there, it would change again tomorrow.
Exactly.
So what about health and the healthy ideal? So any thoughts? You're welcome to use the chat again here. What does health look like, or what's the image that pops into your mind when you think about healthy? This one's a little bit harder. We've got diet and clean eating, glowing skin, an active look. Another person says
white text. Sorry.
yeah,
to read.
thin toned, active look, clear skin, bright eyes, energetic and vivacious, and lots of tanned. Again, this person says lots of salads.
Mhm.
Muscular again, shiny hair. And so noting this, health is often something we want to achieve. It makes sense to want to be healthy and want to, have energy and want to be, and yet a lot of us still go toward an image of what it, that's also, I set you up for that. I asked you about the image, but we often have an image in our mind. We have a visualization for what that looks like. And yet, is it really something visual? Is it something you can see? Or is it something that you have to just feel or experience, or that is in you? And also, is it achieving something that's even in your capabilities to achieve? Can we even is it in our control really entirely? And yeah, there's factors that go into it that are in our control, and there's also some genetics, and there's also some things that just kind of happen, and there's also chance. And so thinking about this as an ideal to achieve and what that sets us up for, again, especially if we're thinking about it in these image-based kinds of ways.
Well, we can also see too, a lot of the things on this list were on our previous list too. So when we're thinking about health, is it coming down to the other appearance ideals, but with a salad or with this idea of clean eating?
Yeah, just labeling them differently. Yeah. Do you want to hit the next slide, Allie?
I am. I'm trying to clear my drawings and it's not letting me.
Annotation is harder than it looks.
There we go.
So I love having this question of like, which is healthier, a hamburger or a salad? And the truth is that it depends. It's a trick question, right? Because it depends. There are some times when maybe the salad is what your body needs and what your body craving, and to balance things out. And sometimes a bunch of lettuce is going to help your body, get its fiber and get various things in your system that it needs. In that case, that's absolutely the right choice. Other times, absolutely the hamburger might be actually what your body needs for nutrition, for health, for energy. Also, sometimes health is bigger than just physical health, and it's about joy, and it's about mental health and enjoyment, and maybe going out and having a burger with friends is absolutely the great thing for you right then. It's a lot more complicated than a simple choice and a simple, is it healthy, is it not healthy? And it's also this piece, it's health is something that is flexible and individual and no one size fits all sort of scenario. And so it's not something we can necessarily see on other people, even in their behavior necessarily, but certainly not in their appearance. We mention this just because a lot of times, especially lately, it feels like people end up conflating looks and image and size, and especially, with fat phobia and fatness, thinking about conflating these things with health, just wanting to be really deliberate as we talk about this and then we think about these constructs and these concepts.
I think with that too, there's also this feeling that there has to be a health prerequisite in order to be respected or worthy of living your life. And so I think it's really important, very similar to what Cara was saying, that we make sure that we are treating people with kindness and respect and worthiness without trying to decide if they're healthy or not, because it doesn't matter if someone's healthy for us to treat them like a person. And I think that's a big message here too.
I love that, Ellie.
And so when we think about this too, we can also think, where do these ideals come from? We get these messages from a lot of different places, but I'd love for everyone to throw in the chat, like, where do you see these messages? Where are you getting these kind of these really deep, narrow messages from?
You ready for them, Allie?
Okay, I am. Okay, now is it wanting to type in? Okay, we're good. Okay, we're good.
Okay, we've got diet culture and media,
Mm-hmm.
lots of media, and then social media explicitly.
Mm-hmm.
Magazines, TV shows, family history, Western medicine, and doctors, and those are two separate people putting those in.
Mm-hmm.
Articles, another media, white patriarchy, commercials on TV, hospitals. We got a kind of a medical theme too. High school, kids at school. Wow, those came in like at the same time from different people. And another PE teachers. Wow, the school ones just came right in a row. Actors, singers, models, public health. I think these are, we've got multiple, like the white patriarchy and whiteness coming in. Other health class at school.
Mm-hmm. I think this just shows how it's everywhere. Like if you turn on the TV, you can get a message there. And there's subtle messages too. It's not always explicit. It's not always saying, do this diet, or if you look this way, everything will be better. It can be even more subtle in the way that we talk about bodies or the roles that certain people get casted in TV shows. It can be the people that are promoted on social media versus the people that are not, or even people whose accounts get removed versus not for similar behavior. There's lots of different ways that these messages are both communicated to us and upheld in society too.
Someone just put Disney in, and I have little kids right now, and the number of times when I'm just like, nah. Like, it's when you start to notice things, you really start to notice them all around you.
Absolutely.
All right, so we talked about kind of what the ideals are. We talked about where they come from. I want to spend a little bit of time talking about like, what are the costs? And I'm going to start actually with like literal dollars of costs. So these are just some costs actually of eating disorders. So there's been a big kind of economic study of the impact of eating disorders and found that the cost to society at large of eating disorders is over $7 billion. The cost to employers and government is $16 billion each. So that means $16 billion for employers, another $16 billion cost to the government. And then over $23.5 billion that individuals and families are actually spending on, all of the various costs of eating disorder treatment, recovery, productivity loss, all kinds of things like that. And these are just the eating disorder costs. And remember when we started talking about body image and appearance ideals, we talked about how eating disorders is one consequence of negative body image, but it's not the only thing. And so if we think about this is the cost of eating disorders, well, the cost of body image and appearance ideals at large beyond that, when we talk about self-esteem, loss of relationships, things like that. And we'll talk a little bit more about the costs afterwards, but this just gets you kind of started thinking about the cost in dollars. And then the others, right? So we have not just money, but what kinds of things, and again, jump into the chat, what kinds of things do you give up, or what consequences do you face if you're pursuing appearance ideals? Anything that anyone could think of besides money? Time, absolutely. So the time that you're spending, picking out the right clothes, things like that, energy, happiness, loss of hobbies, giving up college due to your eating disorder, absolutely. Freedom and independence, distress, sanity, another stress, health, health costs, distance from friends. And I will say even that could be physical distance because of having to travel to treatment, which people have been doing for a lot, traveling places different, but also then that like just emotional distance as well. Isolation, another isolation. Sometimes I hear confidence. So loss of confidence, which then can, if you're not confident, then what things aren't you doing that you could actually contribute in society? And what about authenticity? I love that one. The cost of authenticity. Just the energy of thinking about all the food and the diets, gym, clothes, all the things that you think you need to change. Yeah, brain space for that. How about to society collectively? So if everyone in society was pursuing these appearance ideals, which is kind of our reality, what are the costs at a societal level? for us. Some of them might be kind of repeats, but if all of us are losing these things on the individual basis, then what happens to society? Yeah, so someone just said we reduce productivity. So a cost of productivity at a societal level, absolutely. Depression, yeah. Misknowing depth of personality and character. So I love this like connection piece here, the loneliness and isolation. We don't talk about important things. This one says capitalism increase at the cost or the loss of an authentic relationship. So kind of the superficiality level of things. Loss of creativity, absolutely. Free thinking. This says the energy into how we look and not who we are, which makes me think about like the diversity piece, like the way that society benefits from diversity. But if we're all going for this narrow ideal, then, you know, if everyone were actually to, gosh, we talk about the cost of everyone pursuing the ideals, but my gosh, what would we lose if everyone succeeded? That would be, you know, just the loss of diversity there. This person says lack of family, of being connected. So
there's so many costs on here too. And I think it can just, we could do this for a lot longer too, of listing out the costs and seeing how this impacts all of us, both individually and collectively too. And so as I'm stopping to annotate, here we go. I think the next thing that we want to think about too is who benefits from this? If we are all putting in all this energy, all of this effort, big picture wise, are we personally part of the group that's benefiting? I would gladly give up anything that I benefit from this for the appearance ideals to not exist and for us to be able to live freely and exist in our bodies. And so given all of these costs, I think it's important, and I'd love for everyone, I know we can't hear you, but if you want to answer, I'd love it. Is it worth it, knowing all of these costs? Is it worth it to try to work hard and look like the appearance ideals? I definitely don't think so. And I use the word fat to describe myself, but I'm a much happier fat person than I ever was someone who was trying to be thinner and missing out on so much of my life. Cara, is it worth it for you to work hard and try to look like the appearance ideals?
not at all. And even though it is hard, I will also add the piece that it's not worth it, and it is hard to live in our society and resist it. But yeah, it's absolutely not worth it.
Absolutely.
All right, so I'm gonna pause for a second and just say, you know, we can pause now and just kind of start into some Q&A if that's where people are interested in going. We also have some other things we can do, activities like this. We can keep going here, but I also want to just pause for a moment and see what people would find most helpful.
Yeah, I think that's a great idea. And coming into this, I had the idea that people might want some guidance on how we talk back against these appearance ideals and things like that in the context of eating disorders and in the middle of helping their loved ones recover, and maybe the changes many of us had to make inside our homes to be pro true health, pro recovery supporting. But definitely, you know, folks who have thoughts, pop into the chat about the direction you want this to go in. And if you have questions about that, you know, how you handle this kind of talk in the context in the eating disorder, let us know. There is a question from a parent saying, my kid's in the Freeform group. Is this the kind of things you review with the group?
It is the kind of things. Yeah, Allie, do you want to elaborate more?
Yeah, I would say what I love about the group that we do is we're able to talk, and we'll talk more about that at the end, is we're able to talk about and name a lot of these things so that we know what's going on, because it's hard when we're constantly being told these messages but not able to pick them up or know when they're happening. And so we talk about them, we talk about where they came from, And then we work together in activities and discussions to really start challenging that for ourselves and for people around us too. So really leaning into the activism piece as well.
So there definitely, I think, is some interest in what do I say? Like, that is such a hard part of that when we kind of know it's the eating disorder and we don't want to feed into the eating disorder, but also the pain is so real. And then we also have our own stuff about, I think we get really tightly connected to that piece of the pain because we can resonate with that even if we haven't had an eating disorder. So I think jumping in with that on how to respond to that talk would be a great place to start.
Yeah, I've been seeing some of the questions coming in the chat too, and I'll say one thing that comes up for me is, so when we do our body image group, which we call Freeform at Equip, but when we do it with patients at Equip, we are generally inviting people into that body image group, not right away necessarily in treatment, but a little bit later in treatment. And we do that pretty deliberately because we find that the most effective way to actually chip away at the pressures that people are experiencing and that internalization of those ideals is really to have them engage in some of the challenges, which is to have them, join in together and identify the ideals and say, yeah, gosh, this costs us so much and we don't want to do this and we don't want to, and having them be able to say that, because whenever, this is true for anybody, when we get talked at or when we get told something, it's not going to click in the same way. It's not going to actually if I have this belief and someone's trying to push it away, it's not going to go until I start to do something about it, until I start to take action in a different way. And so because of that, sometimes at the beginning of treatment, when people are just really, really sort of under the influence of their eating disorder, it's just a lot harder for them to take that action and to take that stance. And it can feel just too overwhelming to even try. And so I would say the reaction, to sort of how do I help my child, really kind of depends on where they're at. And so early on is when we want to say this is a lot of validation and say, I know that you're feeling like this. I get it. And we still need to eat breakfast together, and I'll sit with you and I'll eat it, whatever. And kind of just not even try to get into it, not try to talk them out of it, not try to because you're not going to get very far. You're not going to go very far. You're certainly not going to get them to believe something different about their body at that stage. Later in treatment, that's where you can start to have those conversations about yeah, man, this is taking so much from you. Don't you want, what would you want life to look like? And then have them start to be able to work with you, together with you, join with you on talking and doing things that are contrary to those ideals. Are there things that they avoid doing because of their body image concerns? Can they do those things? And maybe you do them with them, do them together. Maybe, you're like, you know what? I know wearing leggings in public with, without a shirt covering your, whatever, it's that's really challenging. I'll do it with you. Maybe we'll do it together. We can challenge it together and do something like that. But doing that early in treatment isn't probably going to get you very far.
Well, and I really like Cara. I think this is such a big, important question for people. And I think one of the things you can do early on before their brains are ready to engage at any logical level with any of this is, first of all, you can kind of try to do no harm. And so one of the pitfalls that I see that happens quite a bit is the reaction to the fat talk is, oh no, you're not fat. Oh no, I won't make you fat. Oh, you couldn't be fat no matter what. That's not your body type. And I approach this conversation with a lot of not judgment and no intent to shame anyone, because every person that I've ever met, every parent has engaged in some form of this. And I also kind of want to highlight that what we do when we do that is we actually make those fears seem very reasonable. It's something I've thought about too. I'm also worried about it. I'm going to make sure it doesn't happen to you. So with all the good intent in the world, we've actually reinforced that fear. So I think that's something really important to internalize early on. And then I think even before you can start having the conversations with them, you can begin to make the changes that will need to be made. I always say that while families don't cause eating disorders, every family has to change to fight one. And most of us have to deal with this. So it's not a guilt shame thing, but really looking at that And there's lots of ways that impacts the nutritional rehabilitation phase as well. I always say that like all teenagers can sense hypocrisy, but none so much as one whose food has heavy whipping cream in it when yours doesn't. So, all of these things are sort of important things to take on in the context of the eating disorder recovery, that if we say, don't be afraid of these foods and don't be afraid of gaining weight, while we model being afraid of those things, we can lose some credibility at those times. We will
I
share
think
some
also with the
resources.
question around, oh, go ahead.
I was just going to say, we will share some resources with this, with a couple podcasts and stuff that have really great content on how to handle these conversations in the way that Cara's talking about, first validating, and then as time goes on, maybe switching up to less engagement with it, and then sort of more positive engagement in terms of talking back to it. Go ahead, Allie. You're a little, we had a little delay.
Oh no. I hope it's okay on my end. So when I think about the question or the specific phrase of like, I feel fat, when I think about what that one is, there's an underlying emotion there. I feel frustrated. I feel upset, angry. I feel discomfort. I feel distressed. Not I feel fat, because fat is it's a body size. It's not it's a feeling. And so finding ways to validate that underlying emotion rather than leaning into the word fat specifically, I think can be really helpful in that early stage. And then when they are in a space where they can talk about it, having that conversation around what does that mean to you? Why are you afraid of fat or fatness? And having into that curiosity specifically.
Yeah. And I want to, Kara, I think you're reading these comments too, and sort of jump in on, the people who are at that stage of recovery where the body dysmorphia is strong. They're not even, you put aside the societal stuff, they're not even seeing themselves clearly regardless, as well as sort of a fixation and obsession with discussing this all the time. And I'm really interested in sort of, I have thoughts about how I handle that as a parent, or see that handled, and I'm interested in your thoughts clinically.
Yeah, I think the not reinforcing part is really important. So in that repetitive, the kind of obsessional thinking that often happens in the context of an eating disorder around body image, of the body checking and body wanting that reassurance seeking. Like, I look okay, right? I look okay, right? I look okay, right? And as soon as you say, yeah, you look fine, you've now reinforced the fact that it was even a question, to that it was like it was a good thing you asked that, because I'm going to go ahead and tell you, right? So as soon as you answer that, you kind of are saying, yep, that was a valid question, when really it's not an invalid question. I mean, I get why they're asking it, and it's not helpful to answer it. And so sometimes what we'll say is, maybe you answer it once a week, or and then after that you say, you know what, it's not helpful to talk about that right now. Let's and try to change the subject, and do the best you can in again, a loving and supporting way that says, like, I understand, that this is on your mind, and I also know that engaging in this conversation is not going to help. So let's, just change the subject and talk about something else. I think there was another question around, okay, yes, I know that I shouldn't talk about, on a day-to-day, but what if there's like asking about something they look for a special occasion or something like that? And I think, JD, we've had conversations with us with other folks about, how can you take how you look in something away from a body shape, away from something else? Can you talk about, colors or excitement? Are you, can you look excited? Can you look happy? Can you look joyous? And are there things that can bring that out in someone, and put the highlight there?
And putting the focus on, is it comfortable? Do you feel, are you going to be comfortable on stage? All of that sort of thing. I do want to, like, on that talk, because I think what you said, it was so important for people to hear about the reinforcement piece of it. And it's really important for folks to really think about this. There's no one answer. There's this answer that works this time, and then maybe it works for a little while, and then you have to change it, that kind of thing. And as you sort of move, in the early stages, that validation of the pain, and it's really important to know, we talk about this a lot in many spaces, that we can validate pain without validating truth. So that person is in pain, and we can validate how hard that is, and then move on to distraction is huge. That is a huge skill in this. That's a really hard feeling to have. Hey, I got to go water the plants. Do you want to come outside with me? Hey, I was just about to do such and such. Do you want to help me, or do you want to watch something? That kind of thing. Also, always like to include some advice from Al-Anon that almost every conversation can be managed with, from your side, with bummer, or wow. And so acknowledges, I'm hearing that you're having these ruminations, but we're not making a thing of it and we're not continuing to talk about it. So having a bunch of different strategies and then using what works, and it's not going to work forever, and then it'll pivot, sort of thing.
There's a question here. What do you say to someone who says they've gotten fat or look fat while they're still well below their target weight? And this one to me reflects a little bit of what Allie was saying about that. Like, I feel fat, but that's not the reality. That's not actually the truth in like an objective statement. And Allie, I don't want to take words out of your mouth, but Allie talks a lot about fat is a neutral descriptor. And yet for a lot of people, it carries a lot of emotion because of the way our society treats fatness and views fatness. And so when our kids with eating disorders are saying, I look fat, or it does carry that emotion. And so then being able to validate the underlying feeling, which is that, and especially if it's someone who has been gaining weight in treatment, being able to validate that, like, they're feeling uncomfortable in their body is changing, and that's creating distress. And we can, both to JD's point of validate and yet not agree with, we can validate that distress and that discomfort with their changing body, and then also kind of help them to accept that and to learn how to find joy in other things in life that are unrelated.
Well, and we know that change is hard in general, whether it's your body changing or things in your life changing. And so finding ways to validate that change is hard feeling, while also providing other distress tolerance things to kind of deepen or decrease that distress that they're feeling around their body changing. And I think, like JD said, distraction can be really helpful. I personally found to have like a basket of things I could do like in a moment's notice. So like there's fidget toys in there, there's ways to like pick up a coloring book, and there's coloring pencils in there, there's really quick like start painting, there's half of an embroidery set, like things that I can jump into right away that can help distract from that distress. And I think it also makes a lot of sense that when they bring up things around fatness or their body, that you have a lot of that distress as the parent too. And so figuring out for you, how can you stand in that moment firm against the eating disorder voice, and then also afterwards take care of yourself, and what kind of distress tolerance tools can you use that can help you decrease that distress? Or maybe you're in the space where you can look into a podcast or read a book about it to learn more about why that fear of fatness is coming up for you.
And for folks who are on here who are in the early stages of this journey, it's pretty impossible to ever think that there will be good things to come out of it. And I will say that I think the number one good thing that does come out of this for families is when the whole family does this work. And that's such a beautiful thing to see people let go of all those things. And it really changes how your family operates. You know, we sort of very early just realized that I don't even think we were sort of particularly bad at all the judgment stuff, but it's still just there. And we made a decision that as a family, we no longer comment on what bodies look like. If they're on TV or whatever, we might comment on what a great runner or that kind of thing, but we're not going to comment on what people look like. And to that question that you said, Cara, and it does come up in every space, like, how do I compliment without complimenting? Like, that is flattering, right? Which we know what flattering is code for. I was actually just thinking about in my younger years, I got some compliments directly related to my body that were sort of societally really good comments. And the comment that I remember most in the scope of my life having to do with my appearance was at my son's wedding, my oldest son's wedding. It was near the end of the wedding. I was picking up a few things, and someone who was getting ready came over, tapped me on the shoulder and said, I just have to tell you, I've been watching you all evening because you're joy personified. And so that is the compliment that sticks with me. And it really actually had nothing to do with how I looked physically at all. It had to do with the vibe that I was emitting. So.
And I was going to emphasize that too, that you can compliment someone's looks without talking about their body. And so people can appear joyous. They can appear, the glowing description that people talk about. It doesn't have to be like a color on someone's face or anything like that, but that's still something, again, but it's not body related.
There is a question I think that's pretty important up here about a 14-year-old who continues to really struggle with body image after having been through, sort of all levels of care and is still spending hours sort of fixated on all of this appearance sort of stuff. Body checking, taking videos and pictures, and sort of setting the stage that we can't really comment on any one single person's case or that sort of thing. Are there some things that would ping for you, or some strategies you would use in that situation, Cara?
I'm actually interested in hearing Allie's thoughts, in terms of, as we've been thinking about, again, like I said earlier, the timing of when would we start to like really dig in and do some of the work that Allie and I have been doing in our body image groups at Equip, and thinking, about what the timing is like for that. So Allie, I don't know if you have thoughts of.
Yeah, I think when someone is in that space where they're able to have conversations, and this is still a pretty prevalent thing in their life for them, I think really starting with curiosity and asking around, like, why do you feel like you need to spend this many hours getting ready, or what kind of things are you feeling when you are getting ready, and really having curiosity around the behaviors and experiences, because something's going on there. And I think also teenagers especially, there's a lot of behavior that is normalized on social media and just among peers in high school. And so regardless of where they're at in their treatment, they might still have a lot of those behaviors that they're still seeing every single day. So they want to connect with peers and think that that is something that is helpful or something they should be doing. And so again, curiosity around that of what would it look like if you didn't do these things, or what would it look like if you stuck with that first outfit regardless of the other ones that you switch into, and leaning into maybe doing some of the things that they're currently avoiding. And so maybe it is avoiding going to school without makeup, or going to school with their hair not done, maybe working on that challenge. And I love Cara's suggestion of doing it together, because that sense of community, that sense that they're not alone in this, and that you too also struggle with this like societal messages that we get, I think can be really powerful in those situations.
And introducing a sort of parent perspective on that, I think everyone knows, I mention this every time I talk in any sort of group, like we kind of don't necessarily always know that we've gotten to the right weight number where that's going to help those things, all of that. So I like really encourage people to keep an open mind about that being part of the picture. And then also in terms of some, sort of pretty specific behaviors, those are things that you as a parent to me are able to interrupt. Like if the phone is being used to fixate, to take a lot of pictures and fixate on those pictures and things like that, you may decide that that's not good for mental health right now. And you may decide that that's a tool that you're going to control and not be allowed to use that way. Sort of those things. You can put some limits on, number of outfit changes, all of those sorts of things, all in a sort of compassionate way, and working, as Allie said, with curiosity to, figure out what's going on and get more support around that. But it may be something that, that you do intercede on. Carrie, you have any more thoughts on that?
Yeah, I mean, my final thought is absolutely in line with what you and Allie have been saying, and is in that curiosity, being able to even talk about, like, do you enjoy those things that you're doing as you're checking the body? Does that bring you joy, or is that, what else would you want to fill that time with, right? We talked about earlier time as a cost. So, and it definitely sounds like all of these things are taking up a lot of time. What else would she want to be doing with that time? And what could we do? And then how could you as a parent help her, just like JD was saying, help her put those constraints on it, right? So like I had a patient once who absolutely was doing the photos she had. If you looked at her photos in her phone, it was just tons and tons and tons of the same kind of body pictures, like on a daily basis. And so we were like, okay, we set goals of like limits to the phone and limits to thing, and we kind of work together on that. And as a parent, you can help say, what do you need, how can I help make those changes, and help change your things, and then fill that time with other things that you would rather be doing.
I think that collaboration can be really great in action too, of these are the things that I'm seeing, and these are the things that I know are harmful. What are you feeling? What are you as the child, like, what are you experiencing? What would you be rather, like, what would you rather be doing? And then how can we work together to both make sure that what I'm seeing as the parent is being listened to and obviously a part of the conversation, but also having that piece as the child of like really incorporating them in it, because that can, I think, kind of help if there's that feeling of, is it going to feel dismissive, or how is, I think it can kind of remedy that piece.
Yeah, yeah, it's so nuanced and changes over time. On that question that you already answered, Cara, but about, have you gotten fat, look fat while they're sitting well below their target weight? One thing I want to introduce into this idea, and I think we don't, I've come to think we just kind of run from this from the time they're very little. I think it's super, not potentially not necessarily in this case, but tied to this. It's really important for us to let our kids know all through their growing up, you will gain weight over your life. If your 13-year-old is upset because they don't want to go over a certain number, I think it's fair to say, of course you will at a certain point, right? And this is that knowing where they are in the journey, but to say, of course you are going to weigh more at 15 than you did at 13, and more at 17 than you did at 15, and more at 21 than you did at 17. And instead of like, it's almost like we're all in this charade where somehow we wouldn't be sort of changing over the course of our lives, and of course we are. Kimberly, the eating the whipping cream thing, super individual. That is your choice as a parent. It absolutely is up to you how you approach that. And so yes and no are individual decisions on that. Yeah. All right. I understand what when she says, okay, she feels self-conscious in her new size and insecure, but I don't know how to respond. Do I always dismiss it? It feels a little mean to do that. I think, Allie, that's probably a really good question for you to answer.
Yeah, I think it can feel, as a child, I think it can feel when you're in that eating disorder voice, or you're in that space, the eating disorder can kind of push you into those emotions. So you have these really heightened feelings. I know this was an experience I had where my emotions were at an all-time high, and I couldn't really control necessarily what I felt in that moment. And yet it still wasn't the space to like go into that conversation. And so I think really leaning into, is my child right now in this moment able to have this conversation with me? And if they aren't, it's okay to really employ, I love the wow, bummer responses. Also, it might not feel great in that moment, and that's okay, because there will be next moments. It will keep going, and they might have another question in a month, and then they might be in a different brain space, and you might be able to go into it. And I think that will evolve over time. And like, I know for me, I didn't do FBT, but my mom was very much involved in my treatment in a different way. And we can now, at this space, like, she can call me and say, oh my gosh, my friend said this about their body, and I don't know, how do you respond? What should I say when I go back out there? And we can have that conversation together. Whereas before, that would have never been something we could have done. And so I think there can be this fear of loss of connection with your child through this. And in reality, it can really create even more connection than you think possible too.
And always, I think, as you have those conversations, checking yourself on, am I having a hard time dismissing it because I also have those feelings, and and really trying, this is what is so hard about this part of eating disorders, is that societal norms and eating disorder thoughts and behaviors are often one and the same. So it's really hard. Where is the pathology piece of it, and where is the societal piece of it? And even as it's the societal piece of it, as we've been discussing here all for the whole hour, we actually want to start to get rid of that too. Thoughts on?
I love that, JD, in terms of the like, when someone says, oh, I'm worried about getting fat, and then that instinct is like somewhere in you, you're like, I'm worried about them getting fat too, like that's gonna come through, and it's gonna interfere.
Get real with yourself. Yeah. On a follow-up to that one about the conversations, was they accuse us of not caring if we don't respond to their comments. And one of the things I want to say on that, because we're going to start to speed round this, we have about 4 minutes left, is there are many times in eating disorder treatment where nothing you are going to say is right. That is a phase of eating disorder recovery where there's not a single thing the therapist can say, the parent can say, the sibling can say. Nobody's going to say a thing that makes it right. And I think in that case, it's okay to save your energy, It's okay to understand I got to feed my way out of this, right? That's going to go away with more recovery, nutritional rehabilitation, weight gain. You know you care, right? And the eating disorder knows that you care so much that being told you don't care is killing you. And so that's what the eating disorder is using. So in those situations, I really encourage you to try not to take it personally and say that's a hard feeling for you to have, and we care very much. Now let's go do X, and just not stay in the conversation and just acknowledge it. This is a phase. It's a phase of things.
I'd even rephrase that says they accuse us of not caring. I'd say the eating disorder
Eating
is
dis-
accusing you of not caring. And when you can frame it that way, it's like, who cares what the eating disorder thinks, right? And I will add that like recovery from an eating disorder is distressing. And if you're not experiencing distress, and if the person with the eating disorder is not experiencing distress, you're probably not moving toward recovery. You're probably in a safe space that's probably safe for the eating disorder to stick around. And so, I mean, I hate that that's the reality, but
Yeah.
it is.
There was a question about like, is it okay randomly to just say to your kid, "You look beautiful"? What are your thoughts on that?
I think there could be lots of things that you can constantly say to your kid. And I think when we think about "you look beautiful," just thinking about like, what are you saying in that moment and what are you finding beautiful about them? And maybe leaning into that even more. So like, I love that your energy looks like your energy is amazing today. Like I feel your energy, or I really appreciate how you are in this moment. And there's lots of ways I think to constantly remind your kids, but I think it's great to throw in a lot of that positive messages when we are receiving a lot of these negative messages often.
This is a really good one. I was a loss what to say when to my daughter when she looked at a picture with her siblings and she said, "Ew, that's how I really look." That's what would your thoughts be on responding to that? It's a hard one.
Yeah, I mean, my instinct is to validate where they're at right now, which is to say, like, I hear that you're really struggling with with your body image right now, and I get it, and I'm here for you.
Mhm. Yeah, I like that too because I think it happens a lot of times too. People will mm, see themselves as much um, they will see themselves as so thin, like to have this breakthrough moment where they do kind of understand how that is. So that's a really good strategy, no matter what. It seems that by avoiding saying how someone looks as they gain weight, they will assume it's a negative and would also reinforce that their body is negative. Um, I would say there are things about this that are not entirely logical, right? In terms of this, um, what are your thoughts in terms of like as someone's going through eating disorder recovery, to comment on it's great you've gained weight or you look healthier. We joke that that's the H word, right? I,
I think the problem is that the eating disorder is going to twist your words no matter what. And so you can say you look great, and the eating disorder might hear that as you look fat, and you say that like the eating disorder, wherever their eating disorder is and it's like control over them, that the words get twisted. And so the absence of something is going to be interpreted as negative, the presence of something is going to get interpreted as negative. Like it's
yeah,
like a lose-lose situation.
I
the
think
eating
also
disorder.
societally, we want to get away from commenting on body size in general, whether it's gaining weight or losing weight. And so moving towards that and modeling that, I think can be really powerful too.
Yeah. If we you guys can stay on for 2 more minutes, we'll sort of finish up. So that approaching weight restored and finding new shape very challenging. That again, acknowledging and reassuring. And I think this is really important. And my daughter talks about this. My daughter, who happens to occupy a body that society looks favorably on, talks about this a lot about how much harder it all would have been if that wasn't the case, right? And so I think it is important to acknowledge at that point where you've got someone who's speaking logically and can engage in those discussions. That's what we're talking about here, where you can say, yeah, society sucks. Let's unpack that. Let's see what we can all do to build ourselves up against that piece of it. And then let's see. a couple questions then that sort of relate. We're going to wrap up with these last questions that actually didn't relate to the body image thing. So sort of going through recovery and going through some stages of treatment, but not wanting to recover. And like, at what point does a family insist on someone over the age of 18, getting treatment? And does somebody have to voluntarily go to treatment for treatment to work?
Yeah, I think it depends a lot about your relationship with the over 18 person, and what kind of leverage you have as a parent. A lot of parents, for someone who's 18, for example, still have a lot of leverage. And a lot of 18-year-olds are not financially independent, or maybe still living at home, or are supported by their parents, and things like that. And so, there is some leverage there, even though they are legally autonomous. And so being able to kind of say, all right, if you're going to live here, we got to do this, or if you're going to, and being able to say that. As we know in FBT, the person with the eating disorder doesn't need to buy in initially. And yet, if you don't have that leverage, then it can be tricky to get them into treatment.
Mhm.
So it kind of depends on the situation.
Adding perspective as someone who did this over 18, I think at what point, I think as early as possible is the best point, because it doesn't get easier the longer that they're sick. I think that's something. And then I like to talk to everyone in this conversation about boundaries. People over 18 have the right to have boundaries about things. There's legal rights that they're given. And also, as I tell people, I'm 58, which makes me 40 years over 18. I still have the right to have boundaries, right? So that we are in a space where sort of all over 18. And so if you define what your boundaries are, that can include not paying for things unless they enter treatment, not having them at home unless they enter treatment, things like that. Always done very compassionately and respectfully, but also with the knowledge that in eating disorders, it's very common. A symptom of an eating disorder is not to want to get rid of the eating disorder, which makes it so darn hard.
I do think a lot of these things kind of come into supportive boundaries in these conversations too, whether it's more widely the eating disorder voice talking, like, we're not going to have these conversations today, like, put a time limit on it, put a week on it, put like a time frame to give you that space to be able to survive through those conversations. And then there's also, once they're later in recovery, we're not going to talk negatively about our bodies. Instead, we're going to talk positively. So if someone says something negative, we're going to stop in that moment and have everyone say something positive. So there's ways to really use supportive boundaries in all of these conversations too.
Yep. And as we wrap up, I want to share one thing from the chat, because people watching this later won't be able to hear it, that I think is really good. A mom was saying there's one point where nothing worked, and she said, I'm not authorized to have this conversation. Please talk to your therapist. I love that. And the therapist had that as well. And so Allie has put up there, our body image program isn't widely open, but had included the email if you want information, freeform@equip.health. And then wanted to preview next week, we are having Megan Helmer, who is our dietary nutrition research director, on to talk about exercise. We'll have a parent as well, and then a peer mentor as well, someone who's dealt with exercise and recovery as well. So look forward to that next week. Thank you so much for everyone for joining, and we shall see you next week.